Meanwhile, the University of Rochester Medical Center is postponing some elective surgeries at its hospitals now.
This in order to make more staff available to treat COVID patients. Kayla Green joining us now live from Strong Memorial Hospital with more information on all this. Kayla.
Adam, the URMC chief medical officer says while they're not short-staffed just yet, they're being proactive to make sure that there is enough staff to treat both COVID-19 patients as we see hospital numbers surge, but also other patients with other illnesses and important surgeries coming up. Dr. Michael Apostolakis is the URMC chief medical officer. He says there are 221 COVID-19 patients at URMC hospitals now, which is more than double the number we saw at the highest point of the pandemic in the spring.
With the surging COVID cases, we need to be prepared to take care of more patients. And we can't wait until we have those patients to make changes to assure that we have enough staff.
Dr. Robert Mayo, the chief medical officer for Rochester Regional Health, says there are 224 COVID-19 patients at RRH hospitals right now, also double the spring numbers.
Over the last week, Rochester General Hospital has expanded inpatient units by nearly 100 beds to accommodate both COVID and non-COVID patients.
Both have started transferring patients between hospitals to keep capacity even, as Governor Cuomo announced as part of his winter plan earlier this week. Dr. Apostolakis says they are trying to delay the lowest number of elective surgeries as possible and will only delay those that won't harm patients if they are put off for 8 to 12 weeks. He says the hospitals still have availability to take care of people, but they learned lessons from the spring.
That we were so prepared for COVID at that time and opened up so much capacity for COVID that I believe patients were harmed from delaying procedures, surgeries, and medical care. And I'm hoping that we can do a better job now of keeping enough staff on the bench.
He also says if you are someone with a surgery scheduled, you should assume that it will go on unless you hear from your medical provider otherwise. Live in Rochester, Kayla Green, News 8.
All right, Kayla, thank you. Both hospital systems, by the way, also urge people to continue following the guidelines to flatten the curve once again.